there.
It's 9 o'clock.
Yes, I know. Okay. 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 Let's see. So I'm just going to put it on speaker.
Sure.
And we will, I'll just keep watching for people who are entering. But if, let's see. So I'm just double check. Okay. A couple more minutes. Okay, I think we're at 11. I'm just looking at how many. Are, okay. Okay, I feel like those 12 were for sure. So I think it's okay to start at this point. And I will, I'll take my video off too when you start talking, but I just wanted to, first of all, say thank you so much for obviously coming and just if you want to introduce yourself and get started, that's great. Okay.
So should we go ahead and start?
Yeah, go ahead and start. I don't know that I actually can turn my camera off because I will just let you roll.
Okay. So good morning, everyone. My name is John Mark, and I'm at the Stanford University here at the Children's Hospital in Palo Alto, California. And I might just start with just telling you a little bit about myself and kind of my journey and how I became interested in this area of non-conventional or non-traditional ways of treating chronic pulmonary disorders such as cystic fibrosis. So I basically grew up in Kansas and went to medical school in Kansas and did my residency in pediatrics in Kansas City, Kansas, and went on to Rochester, New York, where there was a large cystic fibrosis center, and became very involved in my fellowship in pediatric pulmonary there, and worked with a fellow by the name of Robert Schwartz, who trained with Paul de Saint-Denis at the NIH, who was one of the really people who defined cystic fibrosis back in the late 50s and early 60s. And so I really became very kind of fascinated and very connected with my CF patients. In fact, I still follow one of my CF patients now who's almost 40 years of age with 2 children, who's married. It's a Delta F508, by the way. And I followed her ever since she was a preschooler when I was a fellow. So long connections go for a very long time. I then took a job at UC Davis and in Sacramento, California, and I was I was the co-director for the CF Center there in the mid-'80s. And at that time, that's when, before there was infection control and all our CF families hung out together. There was CF camps. Everyone did everything together. They even made T-shirts that said the same thing because we always said, continue the same thing. They even had T-shirts that said, continue the same thing on the back of them because they knew that's what we always said. And during this time, I kind of became a little disillusioned with academic medicine and moved to Santa Cruz, California. And I don't know if people know about Santa Cruz, but it's a coastal town south of San Francisco, kind of known as kind of a hippie type of a place. And there I started doing a private practice, which included some cystic fibrosis patients. And what I found out is that almost none of my patients really, almost all of my patients, in fact, were interested in alternative therapies. So they'd come to ask me about acupuncture and homeopathy and this herbal remedy and this energy medicine and all these things, which I had no training or no knowledge of. But I listened to them and I learned quite a bit. I learned who the Chinese medicine people in town were that treated children and treated young adults and different types of therapies. And sometimes I found that they worked as well or even better than some of the things that I was recommending, such as antibiotics or and maybe things like exercise and sleep and good nutrition is just as important as doing your TOBI and your airway clearance. In 1999, I had a chance to go down to the University of Arizona and work with Andrew Weil, who maybe many of you have heard of, who was kind of the guru in alternative therapies for 2 years in a NIH-sponsored program looking at alternative therapies in children like echinacea and chamomile and acupuncture and mind-body. And during that time period, I kind of got back into academic medicine and that's where I became more of an expert, not in treating, but actually in trying to help families and patients kind of relate different types of therapies that aren't always mentioned in your usual clinic visit. So now here at Stanford, I'm been here now almost 15 years, and I see the patients, both adults and children, who want to talk to somebody about How do you figure out if this is good, this is not good? I heard this from my neighbor. I heard this at the health food store. I read this online. How do you try to sort these things out? So not that I'm an expert in trying to say, oh yeah, you should do this, which I can for some things, but I'm actually somebody who's more of a resource for families and patients. And that's what I try to teach my colleagues. And that's what I'm here today for, to try to help everybody try to see like, well, how do you look at a dietary supplement at the health food store that has like 15 ingredients in it, who all say that they'll either cure or promote lung health, and help with all these different things. And it seems like if that's so easy, why doesn't everyone take it? And so those are the type of things that I try to assist my families with. So that's kind of my introduction, and we're ready to move on.
Okay, great. So if everybody wants to put their questions, I think you can do it through chat, and then I can facilitate those. Otherwise, I can read the ones that that we got through the forum as well. And I'm sure there will be more as we go. But can you maybe, until they start coming through,
Sure,
just talk about some of the key things that you have found like to be really beneficial, supportive to families or individuals with CF?
Well, I always like to bring up the fact that really, cystic fibrosis is a all systems disorder. I mean, it affects just about every area in your body. That's the kind of approach you should have as well. It's not just trying to fight infection. It's not just trying to gain weight. It's not just trying to stay out of the hospital and decrease your exacerbations. It's everything to maintain health. And so the best ways to do that is not to take another pill or another capsule or another concoction, in my opinion, because most patients already take so many already. But the best thing to do is actually live a healthy life and have a holistic approach. So what I really promote is lifestyle changes. And that means good night's sleep, because we know that patients, especially if they have more significant lung disease, they have more issues with sleep time disturbance, which can be really detrimental to your overall health. So people don't often, some centers more than others, are really starting to look at sleep and sleep habits and sleep hygiene. It's a very important part to cystic fibrosis health, because we know if you don't sleep well, you don't fight infections as well, you have your immune responses decrease. So that's one of the areas, is just sleep. The other one that I really try to promote, and it seems like it's so obvious, it would be nutrition, right? But for many, many years, and still some centers still do this, they just push calories, 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 no matter what the source of the calories are. And that's not true. Calories, there's not so good calories. There's good fat, there's not so good fat. I think now most people know that omega-3 fatty acids and olive oil and things like that are much better than trans fats and processed foods, and all those things are kind of markers for increased inflammation. That's the last thing someone needs who already has a pro-inflammatory process going on throughout their body, especially in their lungs at times. So nutrition's the other one. The other thing that I do, maybe it's because that's what I'm interested in, is I promote exercise. And so I think that, you don't have to go out and run a marathon, but if you can exercise, and that could be whatever you like to do, would be jumping on a trampoline or running on a treadmill or going for a walk or whatever, Tai Chi or martial arts, it all promotes airway clearance, playing basketball, soccer, all those things, even for a short period of time. It's just probably as good or better than doing a airway clearance technique like a vest or a pounding or whatever you want to use these days, or a cappella or airway clearance device. And so there's been studies that are even ongoing now trying to compare those. And so if you look at nutrition, you look at sleep, you look at exercise, and then I think those three actually are very important. There are some dietary supplements that I also try to look at as well, but those are kind of my three main ones that I tried to really hit on. I just want to mention one thing, because just for fun this morning, I went and looked on Google. I put complementary alternative medicine and cystic fibrosis, and I had 346,000 hits in 1/2 second. So if you go online and try and just figure this out on one's own without having any assistance from anybody that has any kind of knowledge about this, it doesn't have to be a physician. It could be a social worker, it could be a dietitian, it could be a healthcare provider such as an MD or nurse practitioner. It's really important to have somebody that you can kind of partner with. And I think like Attain Health is one of these partners that you can actually use. And I think that's why that's a very important service that it's not often provided.
Okay, so there are definitely some questions. First of all, Leisha used to be one of your patients, and she was very excited in Rochester. Way back when. Okay, so somebody asked, what type of alternative treatments have you seen to be the most successful outside of nutrition, exercise, and sleep?
Well, I think one of the ones that I think has helped just as a supplement, say, is vitamin D. And I think that we know that people, especially in North America, on the normal population, anywhere, and children and young adults, that 40 to 60, maybe more percent, have low vitamin D levels. And vitamin D is not just this vitamin that's actually not a vitamin; it's more of a hormone that actually helps with immunomodulation and fighting infection and decrease respiratory infections, the severity and duration, like of a cold-like illness, which can cause a CF exacerbation. That you really want to make sure that your vitamin D is up, and you want to make sure now people are talking about levels not of 20 or 30, but maybe even 40 or 50, which sometimes is not that easy to attain. But I think that's one of the things that I really seen that make a difference. If people get their vitamin D levels up into that 30 to 40 range, or even a little bit higher, they seem like they have less exacerbations. The other thing that I really have found to be helpful is actually mind-body type therapies, which means like mindfulness or meditation. Sometimes some of the martial arts like Tai Chi, which isn't really physical, but it has a lot to do with thought. It just decreases stress. And we know that stress now causes a lot of inflammatory response as well. So, families and patients with cystic fibrosis, especially as the disease maybe progresses, are under a lot of stress for school and for all types of things. And so I think that stress reduction, however you want to try to do it, also has made a big difference as well. So those are the kind of ones that I have found to be the most effective. If you look to see supplements, there's hundreds and hundreds and hundreds of supplements, but I think, people have used things like garlic and turmeric and things like that for a long time as well. And some of my patients have really sworn that those have made a difference as well. The last thing I would just say is that it's not always easy, but if you find a really good traditional Chinese medicine person who not does acupuncture and does herbal remedies, some of the Chinese herbal remedies actually are very powerful. And usually they're in a tea or decoction, which are usually taste awful and smell awful. Sometimes can be really very powerful. And so if you find a good Chinese medicine person who is interested in patients with chronic lung disorders like cystic fibrosis, I found them also to be very helpful. But, it's just like any provider, just like physicians, there's ones out there that are really good. There's ones out there that aren't so good, and there's ones out there that you want to avoid. And so that's kind of the trade-off you need to try to figure out.
Okay. No, that's great. I know Maylee just started seeing an acupuncturist. It's been really a good experience. Yeah. Okay, so this is a question, how can I work with my CF clinic if they're resistant to alternative therapies? Any suggestions to help with that?
Well, you can't believe how many centers are still resistant to this. The studies have been going now for the last 20, if not 30 years, showing that anywhere from 60 to 80% of cystic fibrosis patients either have used or are currently using some type of alternative medicine. So why would they not think that would be important to bring up? I think patients and providers now are starting to at least ask about them. But I think one of the reasons that they're so kind of discouraged about doing that is that they don't have the knowledge. So if they ask you about your alternative therapy that you're using, say you're using grapeseed extract, and they want to know if that's okay, and they're like, I don't know, because they have no knowledge about that. Right. So I think it's that what we need to try and do when your CF centers, one, you could ask them to look in the literature or contact me, or maybe I can come out and give them a talk, which I have all over the country from many providers about how to use these different types of resources. But one thing that we've done in our clinic is we actually found somebody, like in our clinic in Stanford here, is actually the dietitian. She's kind of the lead person. And so she contacts me when families bring up these issues. And now what you do is almost all the providers, which there's 15 in our group, they all contact me when they have questions or they have families who bring up certain items. So if you can get somebody who's kind of a leader or somebody who's kind of interested in that area, and almost every clinic has one, whether it be a social worker or healthcare provider, they can kind of help promote that. Because I think that that if they realize that almost all their patients are doing this, and sometimes in lieu of what they prescribe, it's important to do. I would just recommend that that they should ask their providers to please look into that. And if they can't look into that, they should try to find someone in their clinic that could help them, because they really want to do a good job. And I think the last thing I would say is that most studies have shown that people don't use alternative therapies instead of conventional therapies. They use them in addition to. But that doesn't mean that they're doing them in the right order or the right way or the right kind of combination. And I think that's the important thing that you need to sort out. I probably spend more of my time trying to take people off some of the supplements they're on because they're either the same type of approach, or maybe they don't have a good safety profile, as I do try to promote starting ones.
Okay, that's interesting. So what do you feel like would be potentially, if there's if someone from here wants to talk with their physician about this, is there a good place in which to go to find resources, like to start a discussion? And where would you?
There are. I actually pulled online this morning just to see what I could find. There's a couple, like the adult Toronto Adult Cystic Fibrosis Center in Toronto, which is, again, one of the largest clinics in North America. It has a whole webpage just based on alternative therapies. There's different ones you can see, both CF and non-CF. University of Maryland also has a very good website about alternative therapies. The Mayo also has a very good website regarding alternative therapies. Some of the cancer centers like Sloan Kettering in New York and MD Anderson in Texas also have good ones. And they can use that kind of as a way, because they really try to look at this. The best one that you can ask your providers to look at is the one called the Natural Medicine Resource Database, which most people can get online through their university or their setting. And it is actually like the PDR of all different types of herbal remedies. And they keep it up to date on a daily basis, and they have things that you can have the provider look at. It gives safety profiles. It gives all the combinations. It's very, very helpful, and that's what I usually use. And so between those things, I think that most providers should at least have some idea that they can help look up different types of therapies.
Okay, wonderful. Okay, next question. How do you suggest screening for sleep disturbances? Is that through sleep study or?
One of the things that we do, and I have done in the past, is I actually just look to see, first of all, I take a good history, which, sometimes in clinic is hard to do because people are busy and lots of going on, but you really need to find out, especially in our older kids and teenagers and young adults, when do you go to bed? How many hours a night do you sleep? How many times do you wake up? And do you have a chronic cough? Do people, if there's other people in the house, do they say they hear you coughing? Do you have a hard time arousing in the morning? Is it hard for you to get out of bed? Do you feel like you're always getting on the wrong side of the bed? That usually means that you're having some type of sleep disturbance. If you have somebody in the same area, the same bed, the same bedroom, whatever, you can ask them if you snore, if you're restless, do you move all night? Do you wake up in funny positions? Is your night clothes or pajamas, are they have sweaty, soaked because you've been so restless during the night? Those are all indications then to go on to do something more formal, like an overnight sleep study. If you are an oxygen home, you could always have somebody do a recording for overnight oximetry, and they can just download that off your machine and just see, do you have desaturations when you go into certain stages of sleep? But mostly it's history. Mostly has to do with sleep hygiene. People unfortunately use a lot of screen time late, and sometimes we know that screen time, especially around bedtime, can actually cause people to have decreased sleep efficiency. And so all those type of things are just things that people can discuss, and whether a formal sleep study are necessary is important. But I think some centers, especially I think Australia has taken the lead in this. They actually, when you get to be a certain age, 10, 12, 14 years of age, they do yearly sleep studies, just as screenings. And I think they really have found that a lot of people have much more sleep disturbance than they ever imagined. And if you can help improve that with all the different types of therapies, doesn't always mean you have to go on a CPAP or BiPAP machine, but sometimes it just has to do with positioning, has to do with medications, has to do with other things. They can really make life and your health much better.
Okay, great. Okay, another question. Have you studied or do you have experience with CBD, the non-psychoactive component?
No. I guess that's.
I don't even know what that is, so that shows how naive I am. But
I don't have experience though with it.
Okay. If our clinic is not well versed in or open to alternative treatment, who do you recommend we turn to for guidance? I feel like you did that. Yeah. Do you have any recommendations if I can't keep my vitamin levels up? I'm taking 8,000 to 10,000 IU per day, but my level is still under 30.
Yeah, that's hard. That's, I would just, I heard this one person from Boston Children's talk, and he's like the world expert on vitamin D. There's no really high end to it. I might even go up a little bit higher, maybe even up to 10 to 12,000. Maybe try to, again, if you can, sun time is actually good. It's kind of a fight between the dermatologists and endocrinologists and bone people these days. But from 10 a.m. to 2 p.m., don't put sunblock on your legs and arms, and for at least 20, 25 minutes. That's worth 25,000 units right there, they say, international units. And so sometimes even that 15, 20, 30 minutes outside with sunlight, if you're in an area during that time period, can be as beneficial as taking really large doses of vitamin D.
Okay. Hard when you're in New England this time of year, probably?
Yeah, I know it is for sure. When I was upstate New York, they used to actually measure how much sun time there was, and sometimes it'd be less than like 5 minutes a day, sometimes 0 for weeks.
Yeah, not good. Okay, is there a dangerous level for vitamin D?
No one really knows the dangerous level. I mean, most people think that once you get over 60, it's probably not good for you. But again, I've not seen too many really people push it that high. For one thing, it's hard to get it that high. I mean, vitamin C is a different issue where people really, I mean, I've had some people taking, 10, 15, 18 grams a day of vitamin C, which is a huge dose, because most people think that, 250 to 500 milligrams is enough. And these people are taking 15 to 20 grams a day. Usually that just gives you really severe GI upset and diarrhea, and sometimes sets you up for, kidney stones and things like that. But vitamin D, as far as I know, no one has really pushed too much on toxic doses of that.
Okay. What is your take on probiotics, and is there one you specifically recommend?
So probiotics are interesting. I think, we all know that really gut flora and gut microbiome, as they call it now, is really related to good lung health. This is really true for all types of pulmonary disorders like cystic fibrosis and asthma. So I don't think there's any one recommended one that I think is better than the other. I mean, more people are doing more studies. Definitely, if you're on chronic antibiotics or periodic antibiotics, I think that it really has made a big difference for absorption and really keeping your gut healthier. So, I use one that's called Saccharomyces, which is like brewer's yeast. I think that's one that's really been shown for people, especially are on lots of antibiotics, have had trouble with C. diff in their stool, especially chronic C. diff, Saccharomyces. And in the hippie days, what I'm old enough to say about the hippie days, we used to put brewer's yeast on our popcorn, like with a little bit of soy. That was the way we ate popcorn. But brewer's yeast or Saccharomyces is one of the ones. There's different brands that are out there. That Floristar, I think, is one of the ones that they mentioned. But, either things like Culturelle, Lactobacillus, all the ones are actually pretty good. I think that there's been a little bit of a move to get away from the probiotics so much and go to the prebiotics, which is, like different types of foods, especially some of the fermented foods. So if you're fond of kimchi or of sauerkraut or different types of cultured types of sour cream and yogurts, those are all things that actually may be as important as even taking the probiotics themselves. Because you always wonder about those little capsules that are just sitting there on the counter, and they're supposed to have billions of organisms. There's how can that be? How can they really be alive? So then, you think, well, I get the ones in the refrigerated section, that I think if you can eat healthier and take the prebiotics, or the probiotics that actually promote good gut health, that's as important. But the one I recommend the most often, especially with my patients, is Saccharomyces.
Okay, great. Okay, so another question about vitamin D. She's been able to get her level from 33 to 77.
Oh.
And her center is concerned with the level and wants me to stop therapy. Does this seem appropriate to you?
I don't think you need to go any higher. I think if I always try to say that 40 to 60, that's where most of the people that I know around the country are trying to get most of their patients with whatever disorder they have, rheumatological or pulmonary or even all types of things. So 40 to 60 is it seems to be the sweet spot right now, or most people's recommendation. Although, as you can imagine, it's very hard to study, because, how do you study somebody who's going to the clinic when it's sunny outside as opposed to somebody who's not sunny outside, who's taking this and not going and not exercise? I mean, it's just very hard. But I think 70, I've not seen somebody quite that high in the past, but I would think that 40 to 60 would be a good range.
Okay. Have you seen any studies on massage therapy? I seem to be able to mobilize mucus much better after a massage, but I'm not sure if that's just a placebo effect.
Massage therapy is really interesting. There have been some studies, small studies, like almost everything with these types of therapies with cystic fibrosis. And Kathy Kemper, when she was at Boston Children's, even 20 years ago, had almost all the cystic fibrosis patients there either doing usual massage or acupuncture or both. And the patients stated that they actually could have better pulmonary function testing. And they always would try to plan their massage, like an hour or two before their PFTs so they could blow better and so they have a better chance of being discharged. I think massage therapy has been shown to be very effective in asthma. There's been studies on that showing that the kids have less airway problems, less need for their rescue inhalers. It's been shown in the neonates to be very good for growth and actually help their hippocampus actually develop, and they actually have better MRIs. So massage, there's a Touch Institute in Florida that's been around now for 30 years. Who's done a lot of things on massage. So I think massage is actually very effective, and that it helps. I think it can be. I might just mention that, some people think about craniosacral therapy, which is a type of osteopathic manipulation. And some of the things that osteopaths do, if you know a good osteopath who does osteopathic manipulation, some of their things that they do actually is more like massage. And they actually have a whole thing where they actually try to promote lung clearance and mucus production and airway clearance. So I think massage is actually something that if you find to be helpful, if you found a good massage therapist, I definitely would continue that, because I think it's one of the things, again, it's hard to study because it's hard to try to standardize what kind of massage somebody gets versus somebody who doesn't get massage. But I think for the individual person, I think it can be very helpful, and it's also very safe.
Yeah, that's true. It's always the balance, right? Okay, there are a lot of different massage techniques, deep tissue, et cetera. Are there specific types that are most beneficial in your perspective?
Not that I know of. I mean, I would just say what you mean. Some people don't really like the really hard, deep type of massage. Some people think that that's what they have to have. I would just go around and try different ones. It depends what's available in your community as well. Okay. There's one modality I was going to bring up that was just because it was just in a recent study just in the last 2 years from Minnesota, from the CF Center, was yoga therapy in cystic fibrosis. And they actually found it to decrease anxiety, stress, and actually help with joint pain. And so that's a CF Center study that was done at the University of Minnesota. So I think yoga is another one that's actually, if you think about it, it brings in mind-body, it brings in stress, it brings in relaxation, it brings in strength and flexibility. And so it's really a really great one to use all your lung capacity when you take your nice big breaths. Mm-hmm. And so yoga is like the perfect type of a approach if you're interested in yoga. I'm a runner and I don't like yoga, so I've tried it several times and it's not for me, but I think other people really have found it very effective.
Absolutely. No, that's great. What are your thoughts on chiropractic therapy and CF?
It's interesting with chiropractors. I mean, it's always mentioned, and there was just a study that came out in the last year. I was actually out of Europe and showed that chiropractors were still pretty high up there. I always ask people in the room when I give this talk, how many people have you gone to a chiropractor in the last year? And I always, at least 25 to 30%, sometimes more, raise their hands. And I say, well, how many actually had a manipulation where they actually did, where they did the quote back cracking, where they did the high velocity, low amplitude. And a lot of times they didn't do that, because chiropractors now are a lot of times like massage therapists. They do a lot of point therapy. They do a lot of PT. Sometimes they do some supplements. Sometimes they do some exercises for back pain and other types of things. So chiropractors have become a very knowledgeable group of practitioners, because none of them do just the usual chiropractic type of manipulations anymore. I mean, there's some that still do that. But the old days, like in the 60s and 70s especially, you went to a chiropractor, they did a lot of x-rays, they wanted to see you back every 3 months, they wanted to do all these types of manipulations. Now, they still do them, but they don't do them as often, and they've really become much more of a holistic. They take a good history. Sometimes if you go to their chiropractic office, there's massage therapists, there's a physical therapist. They have this whole kind of range. So I find chiropractors to be, to me, a very good group of practitioners to partner with, and I've used a lot of them over the years, especially here in California. But again, chiropractors kind of changed with the days. Back when the chiropractic started, they just did the manipulation therapies, and now they really have spread out. So I think you find a good chiropractor, they're worth their weight in gold.
Okay. Do you think that good posture impacts lung efficiency?
Absolutely. I think if I'm just sitting here trying to sit up straight.
I'm like, okay, you asked that better.
Especially if you have chronic respiratory symptoms, we all tend, even when you're not feeling well, we all tend to kind of not use our lung capacity. We tend to breathe out of just the top part of our lungs. And so different types of therapies, whether it be osteopathic or massage therapies or martial arts like Tai Chi and yoga, they all get you to really stand up straight and try to really become centered and grounded. But there are other types of postural therapies as well that really get you to use your full lung capacity. And, you know, something as simple as diaphragmatic breathing or belly breathing, where you sit on the floor and you put a book on your belly, and when you breathe in, it should raise off the floor. Even that's very simple to teach, but it actually helps you increase your airway capacity, and it'll help affect airway clearance as well. So I think posture is very important. And there's all types of, now, you know, there's everything so fancy. You can get even special t-shirts, just like compression socks. You can get compression t-shirts now that actually help you with your posture and help you stand up straight. And a lot of athletes are using those now, even like ultra athletes, ultra and extreme athletes. So I think posture can be very important.
Okay, awesome. Let's see. Could full spine chiropractic adjustments help people with CF?
Again, it's just like everything else. I mean, I don't see that many chiropractors doing the full spine manipulations anymore. But you know, if you have an area that for some reason is not working very well, I might try it. I mean, again, I tend to be more, maybe because I was with Andrew Weil in Arizona, and he's kind of a big osteopathic manipulation type of guy. I think I had more success with going to an osteopath who does manipulation. Now, you have to be sure that they still do manipulation, because some osteopaths were mostly conventionally trained. They're just like going to a regular MD. Okay. But there's been this whole last 5 to 10 years of pushback. And in Northern California, there's osteopaths who only do manipulation therapies now. And I found them to do very well. And we have a sister of a CF transplant patient here who went to an osteopathic medical school, and now she's doing a family medicine program up in upstate, up in New England. And she's done several studies now looking at osteopathic manipulation for things like chronic constipation and for back pain and for all types of different types of issues. And she uses osteopathic manipulation. It's been very successful, and she's done several studies now. And I think we're going to hear more from her as well.
That's really exciting.
Yeah.
Okay, are there any holistic approaches that claim to help but actually do nothing, or you've seen as harmful?
Sure. Especially some of the supplements, you know, I mean, the one that comes to mind is colloidal silver. You know, people always get into colloidal silver, which has been around for a long, long time, hundreds of years, and it's kind of nature's antibiotic. But, you know, if you take too much colloidal silver and you take it too long, it actually turns your skin blue, which is a permanent discoloration because it gets absorbed. And then for a while, people got into like, well, if it works good to take it orally, why not breathe it in? So they got into this whole aerosolized thing about breathing in colloidal silver. You know, your lungs don't move that out, so it goes down there, it stays there. And so again, that could be a long-term problem that I've seen an issue with. The whole thing, I'd almost hate to bring this up, I'm surprised no one's asked me, is essential oils. You know, people really got into the whole essential oil type of market. And again, if you use it as a diffuser or a vaporizer, or you put it on your chest as to breathe it in like aromatherapy and use it that way, I think it can be very effective. But there's certain companies who do mid-marketing type of a pyramid approach, and people are starting to take some of these orally. And I've seen people and some patients become very nauseated and have vomiting and really get bad headaches from taking some of these essential oils orally, which I really would not recommend. And so again, what I tell people is if they're using something that's supposed to be holistic or herbal in a non-traditional way. So they're using colloidal silver and they're using it as an inhaler. Well, people 100 years ago weren't inhaling colloidal silver, so it doesn't really make much sense to do it that way. The same way for some of the other homeopathic remedies. I mean, we think about homeopathy being very safe because it's very small, you know, even microscopic doses. But there are some homeopaths out there that actually push the doses up. And I've had a couple patients who have taken large doses of homeopathic remedies, and maybe some of you even heard of this on the lay press. There was a belladonna kind of, they used too high of a dose for kids with colic, and some babies had things like seizures, and even there was even a reported death. But they were usually in homeopathic doses. They were using homeopathic remedies in a very high dose. So you have to be careful about how you kind of describe things. But definitely you have to be very careful about kind of what the benefit is versus the risk, and that's what I go over patients every time we discuss any type of a new modality they're interested in.
Okay. Great. So 2 more that kind of piggyback that. Do you have any thoughts on N-acetylcysteine?
N-acetylcysteine is, you know, we studied that here at Stanford a long time ago, and actually it's been now considered to be one of the standards of care in COPD and also cystic fibrosis in some centers. So if you get NAC, which I'll just say that's what N-acetylcysteine is, it actually can be a anti-inflammatory. And so we showed that it helps your neutrophils or your granulocytes in your lungs not be so kind of crazy, not kind of go overboard. So we actually promoted here. It's hard to get a hold of because you go to the health food store and you just buy it off the shelf, sometimes most people feel that N-acetylcysteine actually oxidizes very quickly, and so it doesn't work very well. And so there's a couple companies, and there's one that's in Canada that people can order their N-acetylcysteine from, and so I think that that's good. You can also take it orally. It's the old Mucomyst, and people know what Mucomyst is too, right? So people take it orally, it can actually help decrease your issues with gut immotility and actually help move things through. And some people breathe it in too, Mucomyst. Again, it helps as a mucolytic, so it helps break up mucus. So it could be an anti-inflammatory, it could be anti-mucolytic in your lungs, so it can help with GI. So N-acetylcysteine, as far as I know, doesn't really have any downside. It's just finding the right preparation. That's something that your team should help you with.
Okay. And I have started to see a regenerative medicine PA, and he suggested a couple different therapies: inhaled glutathione and PRP, platelet-rich plasma. Any thoughts on these?
No. I mean, I wish I knew more about him. I mean, inhaled glutathione was a big deal. I don't know if you remember this. It was in all the magazines about 20 years ago. I gave a talk at the NACF, the National North American Cystic Fibrosis Conference, and I thought, I think I'll just have 50 people show up. The auditorium was packed. Must have had over 500 people, because that's when this group out of Utah was using all this inhaled glutathione. And the studies on it have not been very supportive. I mean, they showed that it takes a long time. Sometimes it does replace usual therapies, such as their other airway clearance techniques, and it didn't show that it made, some of the preliminary studies didn't really pan out. So I tend not to promote that anymore, the inhaled glutathione. I'd rather you take oral NAC or some of the other things that are being studied right now. And I can just say that the CF Foundation and the TDN, which is the Therapeutic Networks Development, is actually doing some studies on different types of substances to decrease inflammation. One even is a derivative of cannabis. So the people are really looking at all these different things that are very straightforward and not so high-tech medical as some things are. As far as the platelet-rich therapies go, I've heard of it. I have no experience with it. I'm sorry.
And before we leave the land of essential oils,
yeah.
Is there specific essential oils that are better than others? And I've heard it's bad to diffuse or breathe them in. Is that true?
Well, people have used them for centuries to breathe them in using diffusers. I mean, so that's the way that people have kind of used them, whether it be lavender or some of the other ones. So I think it's not good to take them orally, but I think if you are going to use them, if you use them in a diffuser, that's probably the better way to take them. So I'm not seeing any downside and any bad reactions to those. As far as which ones are better, I would refer you to a practitioner who uses those more often, but I'd be happy to. I try to sometimes look them up and try to figure out which ones are, but there's so much out there right now. It's really hard because it's really taken off with essential oil, especially on the West Coast.
Oh, I'm sure. Yeah. Okay. Do you have any studies or resources to show physicians who don't necessarily believe in stress impacting lung health? Sometimes I'm stressed, my airways become tight, my physician wants to treat me with antibiotics because lung function is down, but I'm almost always able to use de-stressing techniques and my airways open back up to normal on their own.
We should write you up as a case report. I mean, I think that's so important. And I think there's so many studies out there now. I mean, there's so many studies over the last 20 years showing that actually stress actually promotes airway inflammation. I mean, both even in asthmatic patients with no symptoms, they've done markers of airway inflammation, like during test times for college students who have underlying asthma that's actually pretty well controlled. They show increased inflammation. There's a Elizabeth Wright, W-R-I-G-H-T, out of Boston, who for the last 20 years have looked at inner city women, and their babies have more respiratory problems based on the stress of those women in the inner city. And that's taking into account prematurity and smoking and exposure to allergens. And there's all types of animal studies now looking at stress and airway inflammation. I mean, it's just so like, just look it up. I mean, it's so common right now that stress actually can cause decreased problems. I mean, in the old days, just take asthma example, in the 60s and early 70s, we actually used to use things like phenobarbital for asthma because we knew it calmed people down, even though it wasn't a good thing to do because it made you sleep for like 2 days. But if you calm people down, it decreases that anxiety component. Your lungs open up. And we've all seen that. That's why the mind, body, and relaxation and meditation and imagery can be so powerful. And so deconstruction is the same type of thing. So I think you're on the right track for sure. It's much better than going after something with an oral antibiotic to try to hit something that has to do with stress.
Okay, I know we had a couple that came in through email,
Uh-huh.
but in the meantime, can you just talk a little bit more about, I preach a lot about mindfulness to all these poor folks and the important, and just how important it is, but also mindfulness-based stress reduction. And what is your experience with that and the impact on CF and what you've seen?
Well, I think I've seen it work very well in different types of areas. You know, not just in cystic fibrosis, but actually for healthcare providers in a medical center. I mean, we actually teach our families and patients about mindfulness and stress reduction. We also teach our healthcare providers, because what we find out that if you have mindfulness, and this has actually been shown in the psychiatric literature, that if you're mindful with your patients, then actually your patients do better. So you don't even have to teach it to your patients too much, but if you're mindful, if you go in with good intention and attention and attitude, you can actually have a much better encounter. Your patients will feel better. They'll leave the clinic or the hospital in much better kind of mental condition, decreasing that stress, and actually have better outcomes. And then again, I think this is why it's been so important, because if once you become stressed, then you become less attentive and less empathetic, and you start to lose that compassion. And we know that that can now affect patient outcome. So it has to do with both yourself and your family members, but it also has to do with your care providers as well. So it all kind of comes together, that if you do these together, that it can make a big difference. I sometimes get into trouble with this, but I tell some of my patients that if they go in to see their provider and they find that they're not paying attention, they're not being very attentive, they don't have a good intention to make you better that day, I actually tell them to call them out on it and say, like, well, maybe you should just walk out of the room when you come back and talk to me, when you feel like you're ready to care for me as a person and as a family. And if you're so busy and if you have so many other things to do, maybe you should go do those, and we should just reschedule. Because I think that's such an important to have that relationship. And I think you see that when people come in and they're either typing over there on the computer because they're doing their electronic medical record. And some people are very good at it, especially the younger people. They can actually do that and still look at you, but I can't. And so, I think that, you have to have that kind of that one-on-one kind of connection. And if you don't, that's really important. And that mindfulness is part of that. That's how it brings you back into knowing what you're doing and why you do it. And hopefully you enjoy doing it. And I think that's also very important.
Okay. So let's see. Oh, before I go, are there certain mindful practices that are better than others? There seems to be several different.
No, I mean, if you look, and there's different apps on your phone you can do. I mean, there's different ones. I mean, there's so many that are out there right now. Sometimes I keep trying different ones, and I tend to come down to the ones that I do have to do with moving, because I don't like to sit still. I'm not like a sit still type meditative person, but I can go for a long walk and meditate the whole time. I take my trainees, my fellows, we go on walking meditation sometimes, and then we meet and we have different discussions. And again, it just brings everybody. So I think there's all different ones out there. There's not one that's better than the other as far as I know. Whatever you tend to kind of relate to is the best one.
Okay, awesome. A question about kind of the turmeric mix that's similar to Vertex drugs, and what's your thought on that?
Well, there's that New England Journal article that came out, a few years ago now, or 10 years ago, talking about turmeric and how it can make a difference with inflammation and CFRI modulators. And I think that curcumin and turmeric and curry and all those things are probably better taken in foods. I mean, I think that instead of trying to take high doses of the turmeric, which I think some people have shown, you have to take like 30 grams a day to kind of mimic that study that was done in mice. But I think it's just one of those things that I try to do with nutrition. Just same with garlic. We think that garlic is a very powerful anti-inflammatory. Maybe it makes Pseudomonas aeruginosa not talk to each other very well. There's been some studies, especially in England, they're starting to look at different types of garlic. So I think all those ones are very powerful. As far as doses and high doses and how often to take them, I think no one really knows at this point. But people are starting to look into that.
Okay, cool. Okay, let's see, there's one more. What is your take on CFTR modulators and kind of the impact that it's having on weight and kind of that balance?
Well, I think it's so fascinating right now. I mean, it's still, people are just starting to understand how these all work and how they don't work and how all the different types of therapies may affect them. It seems like every 6 months to a year, there's a new CFTR modulator that's coming out that has impacted some people's lives extreme. I mean, not just to the point where it decreases the amount of lung decline they have each year, but actually reverses or actually changes it. So again, it depends on what the particular mutation is. It depends on all the other factors that have to be involved. It has to do with all the other things that have already gone on in one's life, whether it be stress or other inflammations or other infections, what types of bacteria there are. But I think that it's the way of the future for sure. But people are still looking, by the way, at all the different other ways as well as far as nutrition. Excuse me. There's a simple study that's going on now through the CF Foundation and the therapeutic networks about just using a simple supplement called Grow. The study is called Grow. Maybe somebody in the audience is on this study. But it's something about just looking to see whether it helps absorption, just something you take orally that's a very common substance. And so I think that that's actually also a very important thing, not to just look at these medications that cost hundreds of thousands of dollars a year, which is a big deal. But maybe look, there's some things that maybe just be as powerful, as important, just like I talked about earlier with the cannabis extraction being something that actually help decrease inflammation. But that's kind of my take on the CFTR. I think that's going to be the wave of the future for so many patients.
Okay, great. And this kind of piggybacks it, but if you have seen patients who didn't respond well to Orkambi, but have potentially already started, is it Symbeco? I don't even know what it's called, but that have had better experiences with that versus the other.
Right.
Have you had any experience with that?
Yeah, absolutely. I mean, we've seen some people who didn't tolerate the Orkambi at all with either chest tightness or other types of symptoms or didn't feel well, who have now gone to some of the newer ones or the combination ones and have done extremely better on them.
Okay.
So again, I think, sometimes it's hard to get them authorized. It's hard to get your team to change over, but I think that's one of the things that you really have to kind of be knowledgeable about and really try to push as well. I'm not an expert in this area, but some of the people in my group are, so I always push them towards those guys. It's like they push the kind of the non-traditional, non-conventional therapies toward me. But so far, we've been able to sort out who responds best to which medication.
Awesome. Okay. Back to oil. Do you have any thoughts on oregano oil during an exacerbation? I got it out.
Yeah, oil oregano has been one that's been used a lot. And again, I don't really have that much experience, although I have a lot of patients who have tried it. And some say that it makes a difference. Some people don't think it makes much of a difference at all. It's not as much as an essential oil as it is, as you know, a herbal oil, because it's oregano and it's not methanol or eucalyptus or one of those. And so I have less concerns about trying to use that. I think it's probably, if you want to try that, that would probably be okay. But I think it's just something to know that, anytime you're taking an oral therapy, that it may have potential side effects that actually interfere with other medications. But as far as I know, I've not had any significant issues with oil oregano.
Okay. Thoughts on hormones in CF women and any alternative treatments that you have experience with helping the fluctuation in hormones that can make lung mucus thicker and turn PA to mucoid?
No, I'm sorry. I'm a pediatric pulmonologist. I haven't had too much I've had some people that I know of, and there are some people that are area experts in this area. There's a Victoria Mays, M-A-I-Z-E-S, Victoria Mazes, who is at the University of Arizona in their Center of Integrated Medicine, and she has written quite a bit about different types of therapies for hormone regulations and decreasing things like that you have around different types of cycles and menopause and things like that actually can affect your lung function very well. So I'd have to refer that one.
Okay. In terms of nutrition, are there certain foods, dairy, gluten, sugar, etc., that you recommend to stay away from? And are there ones that you recommend to have more of?
Yeah, everything I think that's natural and has less processed component to it, are the most important things to think of. Almost every type of non-conventional practitioner you go to, they'll almost all tell you to stay away from dairy. Because people think that you drink milk, it goes to your stomach and comes out your lungs and nose as mucus. And I'm not quite sure how that works. And people have tried to study that, and it doesn't seem like it does that. But I would say that I've had so many people over the last 30 years say that is effective. So I say I would try, a 2 to 4 week period off of a dairy products. And that means you probably still have a little yogurt on the side, but really stay away from some of the milk products. And sometimes it doesn't have to be cow's milk. Sometimes it could be soy milk. It could be nut milks. It could be all kinds of milks. Maybe it has something to do with the consistency. But try to stay that off for a 2 to 4 week period to see if it makes a difference. And that's probably the best way to sort that out. As far as gluten and gluten-free goes, I mean, that's a big hornet's nest in itself, because no one really knows why all of a sudden, after people have been eating gluten for really centuries, if not longer, now it seems like gluten is a problem. And people will write about, well, gluten has changed. The gluten in wheat has changed. It seems like that's much less. So again, if you can do it, I think a gluten-free diet or much less gluten, give that a trial for 4 to 6 weeks. If it makes a difference, I would say that's not uncommon. We know that children that have, and young adults who have inflammatory bowel disease or irritable bowel disease, some of them do much, much better on gluten-free. And so it seems like if you have something like cystic fibrosis and has problems with GI nutrition, absorption, maybe troubles with constipation, excess stooling, that gluten-free would be something to try as well. And I would say that I've had probably as many patients say that, or more patients say they do better off gluten than on gluten. So I think it's something that you don't have to be like crazy about, like if you have celiac disease where you really have to stay away from gluten. But if you can really reduce gluten, and sometimes it has to do with certain types of gluten foods. I mean, you may have troubles with certain crackers and breads, but you may not have trouble with certain other types of things that may have gluten in it. And again, people kind of have gone crazy now, but there's all types of gluten sections, gluten-free sections in stores now that you can look at. The trouble with that, of course, is a lot of times they're more expensive and they're kind of just as processed as the other one. And if you get a gluten-free pasta, you make sure you need to look at it really carefully, because the gluten-free may actually replace it with something that's not so good for you, like corn or something like that. So you have to look at that too. Same with quinoa. People have kind of gotten the quinoa thing because it's a protein, has a lot more nutrition to it than other types of grains, because it's more of a seed than it is a grain. But sometimes the things that they replace the other things with the quinoa are not as good for you. So I think you have to really look at your labels and become very adept at that.
Okay. And how about sugar?
Sugar, yeah. Sugar is I think most people think now that people shouldn't have gone after fats back in the 70s and 80s. They should have gone after sugar, and I think they're probably correct. And sugar intake, especially the processed sugars, the high sugars, are probably not that good for you. And so I think that there are calories, but probably high sugar content is not as good. It has trouble with your estrogen system. It has trouble with your insulin levels. It has all kinds of issues as well. So I think anything you can do to substitute different types of sugars, have more holistic sugars, like more like honey, buckwheat honey, and things like that, is probably better than granulated sugar.
Okay. Any other questions there? Oh, yep. Let's see.
Caffeine?
Yeah, right. Yeah. Okay. Yes. Do you have any other great insights as I'm drinking my double black tea here?
Well, I'm actually no thoughts on caffeine. I mean, I think everything in moderation is probably fine. I think there's just many studies out there showing that caffeine is beneficial. Let's say it's not beneficial. And if you drink, there's so many products out there, and some of my patients, especially my young teenage boys who want to they want to gain weight and they want to become more muscular. They get into some of these health supplements that have really high amounts of caffeine in it. And you have to realize it's not always called out as caffeine. There's other supplements that are caffeine-like. And so you really need to look at all your substances and your supplements that very carefully, because some of them are very high in caffeine. Sometimes they can have problems with liver issues as well. But just caffeine straight, like from black tea or from coffee, things like that is fine. But if you start shooting down Red Bulls on top of different types of supplements who also have all these different types of caffeine-containing substances in there, it can be very hard on your system and on your heart and your blood pressure.
Yeah, absolutely. Okay. Would you be willing to advise patients remotely?
That's always a hard one to do. Probably not. I wouldn't mind talking to their provider though. And I've had patients from Rochester and Colorado and Arizona and all over the West Coast, Seattle, who have contacted me with patients' concerns because they don't have the answer. And then I'd be very happy to go through that way. I think it's a little bit cleaner that way than me trying to kind of talk to the patient or family directly. And there are people who do that. And I think since I don't know you and can't see you and don't have a relationship with you, I think I'd rather do it to the provider.
Okay. That makes sense. What are the caffeine-like supplements?
I had to look them up. Most of them start with G, like there's, I can't think of, I'm sorry, I didn't
No.
think about that, but
No.
you can, well, what I would do is there's something that says promotes strength, promotes bodybuilding, promotes weight loss, promotes, any type of thing like that. Just take each substance and just Google them quick and it'll come right up and it'll tell you whether they have caffeine in them or not.
Okay, great. Anything else you want to get out there or you think is important that nobody asked?
No, I think that you guys all asked really great questions. And I think this is it was a nice time to talk and kind of promote this. I think you'll be surprised that a lot more healthcare providers are interested in this than you think. I think they just have their busy lives. They don't bring it up. But unfortunately, there still are some that are very, I just had a family contact me through their provider saying that they're really frustrated because they have a provider that's close to their home that just is not open to anything, not even things like mind body, not things like relaxation. And so they're actually going, several hours away to a different center where they're actually more open to it. And I think we just still need to work on our centers and trying to get people to learn this. Every year I and others have tried to bring this up at the North American Cystic Fibrosis Conference. This last year we actually had a session on this type of approach. And I think hopefully we need to hear from our families and from our centers to say we need more of that so we can educate the people who are actually taking care of everybody on a daily basis. I have really great input from nurses. I have really great input from social workers, from dietitians. But like most things, the physicians are the last ones to the table. And I think we really need to work on them as well.
Okay. No, that's great. Well, we also appreciate your time and
sure.
Great to see you again. And
yeah. Thank you very much.
Yeah, absolutely. Okay. Well, have a wonderful rest of your day and hopefully see you next year.
Okay. Very good. Thank you.
Yes.